for the Practical Nurse and Personal Support Worker Acute Care program. Tonight, we have myself, Colby Flanagan, a recruitment advisor with NBCC, as well as instructors Cheryl Ann, Stacy, and Tammy. We have a presentation today. However, before we begin, a few housekeeping duties. So first and foremost, please keep your camera and microphone off during the presentation. This presentation is recorded and will be available early next week. After that, you guys will see a little speech bubble on the very top of your banner. You can click there and it will give you a chat function on the right-hand side of your screen. When you're here, feel free to answer any questions, ask questions, and anything that we might have maybe need to clarify a little more for you. So we will be answering those at the very end of the presentation. So hopefully you guys enjoyed tonight's presentation and we'll talk soon. Go ahead.
Good evening, everybody. My name's Tammy Groom. I am going to ask that my two assistants tonight join, or at least turn their cameras on for just a second so I can introduce them. There's one. Oh, Cheryl Ann may not be able to. Cheryl Ann, oh, she's coming. So just to give you a little bit of an introduction, my name is Tammy Groom. I'm the acting academic chair for the PSW and PM programs for all 6 campuses. So I have a big job. And 2 of the ladies that help me with that job are joining me tonight to kind of just give you an idea of what to expect going forward. So I have Cheryl Ann Clark, who is the coordinating instructor in Woodstock. Okay, so for those of you that are joining the Woodstock campus, you'll see Cheryl Ann around. And Stacy, I think, disappeared again, but Stacy Gillespie is the coordinating instructor in Miramichi. So anybody that's headed towards Miramichi, you will see Stacy again as well. Okay, I'm based out of St. Andrews. So those of you that are in St. Andrews may see me, but I also will be you'll see me at other campuses as well. Okay, so I'm going to try this. I actually haven't done this, but I'm going to pull up a presentation, just a PowerPoint that just kind of guides us in what we're going to talk about tonight. But at any time, if you have questions, please, put them in the chat, and Cheryl Ann and Stacy and myself will answer those as they come. So I'm going to try this. Go.
Perfect. We can see it.
Can you see it? Okay. I was a little worried. So really we just are wanting to meet with you again so you can ask questions, but we can give you an idea of what to expect, what you need to do going forward to get you ready for September. Yeah, let's change. Maybe I'm going to change my slide. There we go. Okay. So are you able to see that one?
Yes.
All right.
Yep.
It just looks different from my side. So many of you have received 2 different emails. One email was just basic welcoming you to the program, giving you the information about your coordinating instructor and who to reach out to. And then you should also have, in the last little bit, received a second email with a lot of details. Okay, so if you have not received that, you will be. I'm hoping that everybody at this point has received it. And like I said, there's a lot of information on there. So some of the things that we wanted to talk about with you are some of the requirements that need to happen in order for you to go to clinical. Okay, so as part of the program, it's not only theory. you realize that. It's also, you know, lab and clinical as well, and I'll talk about that a little bit more. But in order to go into the facilities, we need to make sure that everybody has immunizations done, a medical done, criminal record check that includes the vulnerable sector, CPR, and those things are all really important. Without those, we're not allowed or not able to take you into those facilities. Okay. When you receive that that last letter or email, it should have included a copy of the immunization paperwork or form that you need to have completed. Okay. It's really, really important that now that you've you know, been accepted into the program, that you start working on this. Okay, it's not something that is going to get completed overnight. So the longer you delay, the more difficult it is, and it is going to be something that, again, there is going to be a hard, fast deadline of having this form completed, and without that, you won't be able to go into your first clinical placement. I know one of the things that the coordinating instructors wanted me to really stress is that there are two areas that need blood work, not just record of immunization. Okay, so you know, you need to make sure that you have blood work for varicella, which is chickenpox, to make sure that you're immune, as well as there's a Hep B, hepatitis B blood work that you need to have to make sure that you are you're immune as well. Okay. I won't ask as everybody. There's too many of you to answer that question. I didn't bring the form onto my PowerPoint, but it's very distinct in what it is that it's looking for. So when you're going through it, I know the first one is they're looking for whether you have a tetanus shot and whether that's up to date. And up to date is 5 years. Okay. There's MMR. So most of you had a lot of these immunizations as a child. Okay. So it's really just looking for whether you've had 2 doses of MMR. So it needs to be recorded doses of MMR. Some people are having blood work done for that to show that they are immune to it. But if you've had 2 doses, the blood work isn't required. Hepatitis B vaccine, a lot of you again have had those vaccines as a child. So it's looking for you to have blood work to make sure that you have immunity to Hep B. What else is on there? The varicella. Again, it's written that you require blood work for that one. So to make sure, and again, you have to remember that we're going into a vulnerable population where they're at risk. So we need to make sure that we're safe to keep them safe. At the very, and I know I may have missed 1 or 2, I don't have it right in front of me, but at the very bottom, there's a section for your physician. So this needs to be completed by either your physician or a nurse practitioner. And the bottom is basically a statement just saying that you are fit for the program, basically. And there's a place for the physician to sign and date that. Good. Okay. Sherilyn, you and Stacy, I'll kind of get you to kind of go along with those questions. Actually, and so I know that some of you are international students. So I did reach out to our infection control person within Horizon, and if you have you have your record completed where you are, as long as you bring proof of that, then that's acceptable for Horizon. Okay. Okay. So that immunization paper is extremely, extremely important. The other thing that you need to have done is a criminal record check, including the vulnerable sector. Okay. When you received that second email, or when you receive that second email, there should also be a letter that is signed by me that's requesting your criminal record check. So basically, as part of the program and as part of the institutions or facilities that we're going into, they require those criminal record checks to be done, including that vulnerable sector, which means that that the vulnerable sector part is the most important part of that. Okay, so has to be done within 6 months of starting the program. So if you've had one for work in the past or something like that, it needs to be current up to six months max. Okay. The PowerPoint talks about or has social development checks on here. You don't need to do that. That at this point, that's something that some of the nursing homes that we go into require. So we're not going to worry about that one right now. CPR is another thing that needs to be, or that you should be looking for a CPR program in your area. And it needs to be healthcare level with AED. So that's what you're looking for. They're all a little bit different depending on which institution that you go through. Red Cross, St. John Ambulance. So they all call them something a little bit different, but they need to be for the healthcare. Yep, with AED. You got it. Okay, so those three things absolutely are important, and we are hoping to get those sooner than later from each of you. Okay, because the sooner that we get that and can get you cleared to go into the nursing homes and the hospital settings, the better. Okay, we have had to tell students that they can't go because because they don't meet all of the requirements. How long are programs for CPR training? If it's the first time for CPR, they're usually a 2-day training, I believe. Some are 1, depending on the amount, and a lot of times, yeah, usually 2 days. Okay, good. All right, so those 3 things are extremely important. For you to you can start working on those anytime. Okay. A few other things that we just wanted to touch on, just because, again, transportation. Some people don't realize exactly, how much transportation is required in the program. So obviously, getting to classes is one thing, but also getting to your clinical placements. Okay. So it really does depend on which campus that you're going to. But for example, if you were coming here to St. Andrews, in St. Andrews, there's one nursing home that's local, and then other placements are out of town. So St. Stephen being about 30 minutes away, and then St. John is another. So some of our more advanced clinicals here are in St. John, so that's a good hour away. And then you've got some other placements for community clinicals, that type of thing. So it is important to be prepared to travel. Okay. Again, if you're in the city, a little easier. Right, because you've got public transportation. In St. Andrews, for example, there is no bus system. There's maybe a taxi that comes and goes, kind of thing. So I just want to make sure. Woodstock, I think, probably has still has some taxis there, but no bus. So anyway, you just have to realize where it is that you're going, which campus, and the challenges that there may be around travel. Childcare. I didn't make the slide, but just something to consider as well. So, you know, classes are classes. So our normal schedule is 8:30 to 4:30, Monday through Friday. Again, we'll talk about what that may look like come fall. But you also have potential of doing evening shifts for clinical. Okay, so when the clinical schedules are posted, there is a chance that you're either doing a 12-hour shift, which would be a 7 a.m. to 7 p.m., or you may be doing a 3 to 11 shift, okay, or an evening shift. So just kind of giving you a heads up that if you have children, that might be something that you need to consider. Okay, accommodations, as in places to live. If you're, you know, again, knowing if you're local to the campus, then you're, you know, but if it's, again, you may want to be thinking about where you're going to stay ahead of time. And support. This program is a pretty intense program, and I think you know, anybody, if you've talked to anybody that's been through the program, you know, it's busy. It's hectic. Some terms are busier than others. So it is important that you have, you know, some support system in place, and support is, you know, is really important during the program for sure. Okay. That took a lot of time on one slide. I can't tell you much about orientation at this point because there's not a lot in place, and part of that is because we really don't know. Thanks, Sherilyn. We really don't know what the fall is going to look like for 100% sure. We're really hoping that things will be looking more like normal, but we can't, you know, we can't say that right now. So, you know, I do know that orientation day, so everybody will have an orientation day that's September 7th. That's built into the schedule. So the first day of classes / orientation will be September 7th for both PSWs and PNs together. I think that there's something that's in the works for September 1st and 2nd for the transitioning to college life. So some information there. Okay, but as far as the orientation process goes, I'll just tell you that you'll get more information as the time gets closer. Okay. So for the PNs and PSWs, you're going to be together for the first 2 terms. Okay, so what I have just in front of you right now is the courses that you're taking in the first term, okay, which looks pretty heavy. Okay, so there's 1, 2, 3, 4, 5, 6, 7, 7 plus the bottom 3. Okay, so there's 7 courses that, you know, so it is a busy term. All right, I'm not going to lie about it. It's going to keep you busy and on your toes. So anatomy and physiology, a critical reading and persuasive writing, ethics or ethical and legal frameworks in healthcare, healthcare in Canada, basic nursing care concepts and skills, which gets you started into some of the skills. Introduction to the nursing profession, an interpersonal communications course. So these are all things to just get you started. Okay. There's also 3 other things here. That's orientation to community service. So if or the orientation to community service is something that is required of all NBCC students. Okay, and it's basically a volunteer day, and with a little bit of work around that, so you'll get lots of information. So it's not. It actually gets it is included on your transcript, so it doesn't get necessarily a mark. It just gets that you've completed it. Back and form is included with usually with your basic nursing care concepts and skills, and that really gets you ready or so that you're safely moving patients. That's how I'll describe it right now. And then Work Safe is another course that is basically done on your own online, but it is another requirement of the program. I see somebody has mentioned if you've had some of these courses, there is a process that's called recognition of prior learning. Okay, so if you see courses here that you've taken before or something that looks similar, you can apply for this recognition of prior learning, and potentially, once it's reviewed, not have to take that course again. If it's the exact same course code with exactly that, that you've taken in maybe another NBCC program or something like that, if it's on your transcript, then you probably don't even have to go through that process. But everybody, if you have courses that you think that would be equivalent, you can certainly ask for that recognition of prior learning. Okay. So course delivery, that's what I was talking about. I'm not leaving a lot of time for you guys to ask questions, but course delivery, again, right now, we can't 100% say exactly what the fall will look like. We're hoping that, we'll be more face-to-face up until, well, even this term. We have been only face-to-face for labs and clinicals, and all theory courses have been virtual. Okay. What we're hoping for, what our goal is face-to-face of about 40, somewhere between, which is a huge gap, but 40 to 80% face-to-face. There are some courses that work virtually, some courses that you'll do both. It'll be combined. Some will be face-to-face for most of the course. Again, depending on what lovely COVID does, and where we're at in the fall. So some of you have been probably accepted into St. John, the online course. So primarily all virtual or online. And then the simulation part of things. So, and I'm going to talk about that really quickly in a few minutes, but part of the program is lab. And so you'll be in lab practicing those skills that you're being taught before you go out to the clinical setting. Okay. And Cheryl Ann, I was just going to tell you, so one of the things that's really important for fall is that, that you have a good source of technology. So Cheryl Ann's just going to kind of go through what those requirements are, and I'll come back.
Hi, everyone. So, of course, seeing as things are delivered in a virtual format, it's very important that you have a computer that has working audio video capabilities. So we need to be able to speak back and forth. Sometimes if we have meetings, we'll be meeting just like this through Teams. So it's important that you have that. When you have your online classes, you're also meeting through an online format as well. And it's very important that cameras can be turned on and your instructors can see you because, as you know, for you guys that are in the meeting, if Tammy and Stacy and I were just in here and all you could see was the little bubble with our initials on there, but no faces, it's very hard to kind of connect and kind of generate some type of a foster a positive learning experience there. So we need to be able to see you guys. We need to be able to that's part of the way how we verify your understanding of what we're talking about, right? So so when I'm talking about software, I can actually send out the link to the students on my Woodstock list. I'm sure the other CIs can do the very same thing, but there's actually a link on the NBCC website that talks about the IT requirements for students. So it kind of lets you know what it is that you need, what you're going to kind of be using for programs. And I know that we've had students in the past that are very concerned because they feel they're not technology kind of savvy people, and it's okay. Our help desk is wonderful. They're available always to help you load these programs on your computer and such like that too. So the main mode of communication that we use with you guys is it's really a program through Microsoft Office. So this Teams is through Microsoft Office for any who didn't actually have it and had to download it. It's a really user-friendly kind of program to be able to use. So a good thing about being a student is you actually get a link for those programs. So you don't have to go out and purchase these programs. You'll actually get a link and then it'll show you how to download it onto your. We also usually tell students too that when you're purchasing, if you're going to purchase a computer, it's important that you have a computer that is able to support what we're using. So again, on that IT, on that little site on the NBCC page that I can send around, it actually tells you kind of what the requirements are, because one of the things in particular that we use is called Lockdown Browser. And Lockdown Browser is just something that sometimes instructors use for when students are doing tests and such like that, because sometimes if you're writing a test, you're at home, you're not in front of your instructor to write it. So it's just that way to verify your learning with that. That's all. Is there anything else in particular, Tammy, you can think of that I missed, or I don't want to ramble?
I'm talking and I'm muted. Leave it to me. Just as far as what we use for a platform for educating or whatever I want to say is Brightspace.
That's the most important thing.
That's okay. That's all right. No, I was more concerned about the technology and just making sure everybody had the proper equipment, to be able to. Some people have tried to do join virtual classes on their cell phones. Tablets, I think, work a little better. Cell phones, I don't think it can be done, but I don't think it's a very good way of being in the virtual class. I know that it doesn't allow you to do certain things and that type of thing. So it is important that you really have that ability to use a computer that has all of those requirements.
I have spoken to some students, Tammy, that have they've been having a lot of issues with Brightspace. With apparently it loses some of its ability for what the students can see. So students have attempted to try to do tests with their cell phone or try to access Brightspace, and because the phone doesn't have the capability to support it, it loses a lot of the functionality, which means sometimes students get kicked out of tests, and that becomes quite a large issue. So.
Okay, we'll keep on going. I think one of the questions, and I probably could have just said it out loud, but Lockdown Browser is part of Brightspace, so it's not something you may have to download it on your computer, but it is through Brightspace. Can we bring a laptop from the Philippines? As long as it has the the requirements, it should be fine. And as far as I know, I don't know any of the campuses that sell laptops, unless somebody else at another campus. But I don't. I just see that's a question. But lots of places around, but not on the campus. All right. Quickly, and you'll get this. One of the things that I do want you to be careful with is if you are considering buying secondhand textbooks, a lot of the textbooks have changed in the last couple of years. Okay, so just pay attention if you're doing that. I see a lot of our old skills textbook online for sale, and don't buy it. It's a good book, but we're not using the old textbook. So this just gives you an idea. You will get a textbook list that gives you very specifics, but anatomy and physics. Anyway, these are your courses that you're taking that require textbooks. There is a big textbook now that's called Basic Nursing Fundamentals of Canadian Nursing. It's actually it's a huge book. It's used for multiple courses. So I have here, you can see the basic nursing care concepts, and then Introduction to Nursing Profession are both from the same textbook for this term. This is all just for first term. There's a couple of classes that there's no textbook for. And then Anatomy and Physiology, your structures and functions of the body. Persuasive writing is writing for Canadian health professionals, and healthcare in Canada is healthcare delivery in Canada. So that just gives you an idea. But again, just be very careful about buying secondhand if they, and check to see if it's the same textbook. It's okay, I think, for it not to be the same edition for the most part. You just have some usually page numbers is the big thing with those, but definitely don't buy the wrong textbook. You'll have opportunity once closer to when school starts to pick those books up, and you'll get more information about that. Stacy's going to talk about dress codes and uniforms and that type of thing. Oh, you're muted.
Yep. Can everyone hear me okay? Because sometimes my internet's not great.
Yeah, that's good.
So we'll talk a little bit about dress codes, what you'll need for lab and clinical. You'll need to buy specific uniforms that are specific to NBCC. They will have you get them embroidered with the NBCC logo. And when you come to campus, each facility will have a representative from the scrub shop where we're buying them from, or a link where you can purchase the scrubs, because everybody has to have the same color and similar styles. Fortunately, this year, we do have a couple of different styles to pick from, so that will hopefully suit everybody's body type. We want it to be a good, well-fitting uniform. Please make sure that when you purchase your uniform, that you get a style that you like, that fits you well, that's comfortable, that's hemmed. We don't want pant legs dragging and body parts showing. When we go out into the community, we do expect you to dress in a professional, business casual manner. No pajama pants and things like that when you come to campus. Make sure that you have at least one good pair of dress pants, and you can recycle those. We do need a watch with a second hand. You'll need that for clinical and for lab. You need a pair of white duty shoes or sneakers, not skateboard sneakers or Converse and things like that. Actually, a pair of supportive sneakers that your feet will thank you when you're on your feet for a long period of time if you get a good pair of shoes. You'll actually need, Tammy, you can correct me if I'm wrong, but we always tell the students they need 2 pairs of shoes, one for lab and one for clinical. Once you wear your lab shoes to clinical, then you can't wear them back into the lab again because of the germs and stuff that you pick up while you're in the hospital. A stethoscope. Ideally, you'll purchase a stethoscope. Doesn't have to be a Littmann, but a stethoscope with the diaphragm and the bell, so it has two sides to it. And those are things that you can get now, or you can get, I know a lot of the bookstores sell stethoscopes. Like I said, you could purchase online, or you can purchase from the bookstore. Dress code do's and don'ts. We just want to make sure that your uniform is well fitting. It's laundered every day. That it's, like I said, it's hemmed. Your shoes must be closed-toed and closed-heeled, and that's for safety. You can't have flip-flops or Crocs or things like that that aren't that don't meet the work-safe code. We also ask that you wear a simple wedding band. If you are married, you can wear a wedding band, but no other bling for that, and a single pair of studs. We don't usually allow piercings other than 1 pair of stud earrings and your wedding band. And something else I'll mention as well is artificial nails, gel nails, lashes, things like that. We also don't allow those because we follow Horizon's dress code policy. And that's where we do a lot of our clinicals, is within the Horizon Health Network. And you can't have stick-on nails, nail polish. Those are things. And we'll go over this when you come to class, or we meet in the first couple of days in an orientation. But I just wanted you to know that you didn't have to go out and purchase your uniforms beforehand. Those will be available and in lots of time for clinical. Keep an eye out for good, comfortable shoes or sneakers, and hopefully you'll be able to find all the things that you need, your stethoscope and all of that, either online or at the bookstore. Thank you. Back to you, Tam.
Thank you, Stacy. What was I going to say? There was something I was going to say, and now I don't remember. I see some
Someone
questions.
just asked about smartwatches.
The smartwatches, and I honestly don't have an answer for that. That's something I'm going to have to ask about the smartwatches, because there is a no cell phone, no device policy on these units. So that one I'll have to ask some questions about. Okay. And somebody had asked about earrings. Earrings are okay as long as they're small studs. That's right. It has to be studs. The hoops are actually. Do we add hoops, small hoops to the policy? Do you have that, Stacy?
I think it's just simple studs.
Okay. All right. Somebody had asked about dress pants for theory classes. Most campuses, I won't say all campuses, don't have a specific dress code for class. When Stacy was talking about dress pants, that was more for going out into the community. not that we want to see poorly dressed or anything in the classroom, but yeah, I don't think there's that for theory courses. It's more for going out into the community. Somebody's asked about blood pressure cuffs. That's not something you have to have, but some people do like to get them. One thing about the stethoscopes is I would not go out and buy the cheapest stethoscope that you can get, although they don't have to be the most expensive either. Some of the really cheap ones, you can't hear anything. Okay, just to give you a little bit of a heads up. Our scrubs are actually going to be being supplied by Scrubs Plus in Fredericton. But like Stacy said, they're planning to come to each campus, bring some samples, and let you try on before you order. Okay. So it's just something to be prepared for. This is just kind of giving you an idea of what, and this is not what every campus looks like, so don't get extremely excited, but you know, the program has opportunities to work in the lab. You guys will actually be starting in the lab in the first term with your basic skills, okay? No clinical until second term, okay? So the clinical for you guys will not be until winter term. So it's pretty exciting stuff. The clinical experience, again, you know, basically we teach a certain set of skills or assessments, and then, you know, you practice in the lab, and then you go out to a clinical setting. All right. So initially, so the first time is usually a nursing home, and then we, you know, move on up to hospital setting, acute care settings, and then depending on PSW versus or PN, the PN program gets into more advanced skills, and again, then your clinical setting will basically get more advanced. And we'll talk about some of this stuff. I'm not going to get into, you know, there's going to be IDs that you need to get, security cards. I'm not right now. We've got lots of time before clinical happens. So some support services. I believe that you guys have heard a little bit about, you know, what we offer, or you've, I know that lots of people have introduced themselves as part of College Preview Day to give you an idea. Student Success Center, you'll have lots of dealings with Student Success Center. We do offer counseling, so well-being counselor, as well as a learning strategist. Okay, and the well-being counselor, and right now I think it is changing. We have one for our school. So our school is the School of Health and Wellness. So it's the same person. And we also have a learning strategist that's just for PSW and PN, actually, the School of Health and Wellness. One thing to consider, so accommodations is in the next block. If you have already had accommodations, so things like extra time to write tests, readers, those types of things, reach out to the learning strategist early in the program to get those things in place. Okay, if it's something that you've already had, it's, you know, and we just need to continue it, you'll get that information about who the learning strategist is and how to access her, and get a plan in place early so that, you know, those things happen. If you're finding later on that things are, you know, things are a little bit, you know, iffy as far as, you know, test taking or time, you know, anyway, there's things that we can have set up with the learning strategist. She's also really good at, you know, helping with organization, time management, you know, those types of things. Tutoring, so different options. But if you're finding that things are difficult, there are some tutoring options. There's actually something called Tutor Me that's part of Brightspace. It actually gives you access to an online tutor 24 hours a day, 7 days a week. So if you get into a question with that, you know, or something that you're really stuck on, you can use that, you know, as the Tutor Me to have that conversation. So it can be anything from something, you know, a single question to up to 3 hours of tutoring. So 3 hours, and so you're able to use, I think it was about 3 hours every week of Tutor Me, free. There's also, you know, later on, if you're feeling that you're struggling a little bit, the learning strategist, through the learning strategist, can set up actual tutoring, so peer tutoring, that gives you at least 10 hours of free tutoring, and then it can go on longer if the need is there. Cheryl Ann, I just saw that she mentioned that they also organize something called a learning circle. So if there's a need, if there's things that, you know, maybe students are having problems with, it may be things like, you know, or kind of talking about how to write a paper, you know, things like citing APA format, all of those fun things. You know, there are, so watch for those notifications, you know, as things go on. Library. So our library commons is a website now, but you can access a lot of different things through that. Each campus does have a library as well that is open, I'm going to say right now, or hopefully by fall, 8:15 to 4:30, with computers, Wi-Fi, you know, those types of things that you can, it's a quiet place to work. And then student life officer and local campus unions. Again, this year has been a little bit different for that because we haven't really been able to do anything. There's been some virtual events for students, but hopefully as time progresses and things get better, fingers crossed, the way things are going, you know, they'll be able to do some more activities, extracurricular events, community work, those types of things. Okay. Just some things to keep in the back of your mind for fall. The health department, just to get a feel for there's a dean. So things have changed over the last few years, and we really are broken, or we're into different schools now. So we PSW, PN fall under the School of Health and Wellness. So our dean is Ray Hubble. So you'll see his name come up. I'm the academic chair, or the chair of nursing, administrative assistant. So I'm not going to give you names right now because by fall I think that's going to change. There's coordinating instructors. So the two ladies that are on with me today are coordinating instructors at 2 of the campuses, but there are coordinating instructors at every campus. So I'm overall 6, and then there's a coordinating instructor that's at each campus, and then you'll get to meet instructors as well. So depending on the campus, the number of instructors. Okay, so that just gives you an idea there again. It's parking. So I already talked about transportation and how important it is that you have a reliable source of transportation. You know, and think ahead when it comes to labs and clinicals. And community clinicals, all of those things, so that you're able to get there. And again, campus parking, is really dependent on which campus that you're at. Some of the campuses are paid parking, some are not. So you'll just have to, depending on which campus that you're going to. Clinical parking, most clinical sites also have require payment, just to, again, things to keep in the back of your mind. The bigger facilities especially, and the community partners as well. And I think this might be my last slide. So at each campus, there are lockers. So more so for just to give you a heads up, most of those, most of the campuses require you to have your own lock. We supply the locker, but you have to supply your lock. Most of the bookstores have those as well, but it's just one of those things. So just, again, to think about. And that, I've talked for a very long time. Does anybody have any questions?
Tammy, I saw a question in the chat. Sorry, I don't know if you can hear me very well. I saw a question in the chat from a student. I don't know, I've got a frog in my throat. From a student just wondering about the process, if they took the PSW course and they were moving on to the practical nurse course. And I had kind of wrote in there that depending upon when the PSW course was taken, you might be able to be recognized for some prior learning. We did have a curriculum change in 2018, so we would have to submit, I guess. So whatever college whatever campus you're going to, it's a really good idea to communicate that with your coordinating instructor, and they'll walk you through that whole process.
So one of the things that we'll do at the very beginning is give you something that's called a program map that gives you an idea of what courses and when and that type of thing. And then you can also look at, compare it to what you've taken before. Yeah, no. So somebody just asked about whether clinical placements were flexible, and unfortunately, that's not. When it comes to preceptorship, potentially, we can look at different places, but it is with a certain instructor that you'll go to those clinical placements. Okay, the PSW course and going into the PN. The one thing that I do want to, I'll just want to clarify just to make sure everybody's on the same page, is that there is no bridging program from the PSW to PN. Okay, sometimes people have gotten that kind of misconception. There is that opportunity. Sometimes seats become available so that you could transfer from PSW to PN. But that's, that really depends. Okay, so there's no guarantee that, if you're in the PSW program right now, that you can automatically go into the PN. It really depends on the availability of a seat. Oh goodness, the questions are coming flying. COVID vaccine, I'm seeing some questions there. It is not, as far as I know, I've asked with Horizon, and it will not be mandatory. But the only thing that I can say with that is I know that flu vac, that was one of the other things that was on the physician immunization medical form, was the flu shot or influenza. So the only thing that I can say about that, if you don't have the influenza vaccine, then if there's an influenza outbreak, then you have to, or even if there's potential for it, you're wearing masks all the time. Although I guess we've kind of gotten used to that. So I don't know what it'll mean for the student that doesn't get vaccinated. I'm assuming it's more precautions, but just so you know, but it is not mandatory. Some people are asking about whether they can email scan, fax, copies of the immunization stuff, and the CP. Really, any of those can go directly to your coordinating instructor, and they'll keep track of those. And something that I'm going to throw out right now is, because I was a coordinating instructor until I took this role, is please, please, please make sure you keep copies of everything. Okay, you're going to need those when you're done the program and you're looking for work to start with, and you know, don't rely on us to have to give you copies after 2 years. Okay. I don't know exactly what somebody's asking about textbooks over whether they could buy them over the summer. I would check to see what the hours are. I would check to make sure that the hours are and if the bookstores are open before I made the trip, but I'm certain that you probably could buy those over the summer.
I think pretty soon that we, like the coordinating instructors and yourself, I think, Tammy, get an email to mention what those summer hours are.
Okay.
And I think, I know I usually try to stick that link in an email as I'm communicating with the new students over the summer. They can also get them online too. I think there's also that availability if students were interested.
Yep, for sure. CPR is 6 months, unfortunately. Okay, so it needs to be a new CPR within the last 6 months. Anybody see any other questions that I'm missing?
I was going to actually mention, Tammy, I noticed that somebody was wondering if they could purchase textbooks at another campus. I think, I don't know what your thoughts are, but I think that each campus purchases their textbook like according to what we've put in for orders. So they really prefer for the students to order them from the campus. I think that they're going to be attending. Am I right about that?
Yes, we do submit numbers of students. So yeah, that would be the preference, I'm sure. Anything else?
So we have a couple minutes, so we'll give another minute or two. Just had a question here come in.
Yes. So Taylor, the vulnerable sector is the most important part of that criminal record check. So unfortunately, you'll have to have it done again. So make sure that you take the letter because I think that's why they don't tend to do the vulnerable sector unless you request it and you have a reason to request it.
Tammy.
Yes.
It's Stacy. I just wanted to mention that last year some of the city police didn't actually do the vulnerable sector. They just did one criminal record check or the vulnerable sector, but they didn't do, some of the city police didn't do both. And I actually had to call the office, and the clerk told me that they don't always do them both anymore. Our CMP still do them both, but some of the city police, when they do a criminal record check, it's like a given that it includes the vulnerable sector now.
Okay.
I didn't know that until I came across it like last fall.
Yeah. Okay. Well, we'll have to watch for that because I know
Yeah, some of the
for
students
sector.
might just need to show them the letter to get the vulnerable sector.
Regarding study permits, all of that would have to be answered through international. So your best bet right now is to email international@nbcc.ca. But just so you know, there's still, I guess we still have about 12 weeks before we need those submitted in.
Tessa, you're right. So if it expires, yeah. Ding, ding. Anything else before we sign off? I know it was a lot of information. I talk pretty fast, although I talk a lot.
All right. It looks like that is all for the questions. Thank you again, Tammy, Cheryl Ann, and Stacy for joining me tonight on tonight's College Preview Day webinar. And we are very excited to see you guys in a few more months. And if you guys have any questions that you think of over the next few days, feel free to contact me directly at collegeworks@nbcc.ca. All right, bye everyone.
Thank you, guys.
Thanks, everybody.
Bye.
Bye, everyone.